Welcome back to County Connection. For this next segment, in celebration of Month of the Young Child, we are going to be focusing on the Nurse-Family Partnership, which is a program housed in Summit County Public Health. And we have several guests with us for this segment. We have Lynn Easterly, who is the supervisor for Nurse-Family Partnership. Welcome, Lynn.
Thank you.
And we have Nadine and Isabella Castillo, who have been participants in the program. Welcome, Nadine and Isabella.
Thank you.
All right, Lynn, why don't you kick it off for us by giving an overview of Nurse-Family Partnership?
Okay, Nurse-Family Partnership is an evidence-based program where we serve first-time pregnant moms in Summit County and the surrounding counties. It's a free program, it's voluntary, it's a program where we try to follow your heart's desire. What are things you want to talk about? How can we support you? What questions can we answer? As moms and dads are becoming new parents, it's a fun place to be sometimes.
And so the program includes nurses going into the homes of new moms, and what a great time to have access to your own nurse coming right into your home to answer questions during a time where I expect people have lots of questions.
They do have lots of questions. And the more support, part of the theory is that the more support that the family has, then the easier it is to become the parent that you want to be. And so we provide some of that extra support.
All right, great. So give us a little background on the history of Nurse-Family Partnership and how it came to be in Summit County.
Okay, Summit County, it was called Nursing Services at the time. In April of 2001, they started a Nurse-Family Partnership program here, and they had to connect to 3 other communities in order to have 100 clients. And those communities were Gilpin County and Clear Creek County and Lake County. And
yeah.
So
great. And then, so over the years, the program has really grown, and both geographically and in numbers, right?
The program has grown. Since that time, we've expanded to Chaffee County, to Grand County last year, to Park County, just the year Alma and Fairplay, and we serve up to 145 clients.
Awesome. Great. And then how many clients have graduated through the program?
So part of that is we're celebrating this year 15 years in this community, and we've served almost 1,000 clients, 994 clients, with 334, I believe, graduates from the program.
All right. That's fabulous. So Nadine, how did you decide that you wanted to be part of the program?
Because we wanted to be better parents for our daughter and provide a happy and safe home for her.
Okay, and can you describe kind of what those visits were like and what you saw as the biggest benefits of participating in the program?
Because they help us to, well, as new parents, your fear is like, am I going to be a good parent? But
sure.
Once the nurse went into our home, she answered many questions that we had regarding the development of our child, eating healthy to make sure I had a healthy pregnancy, and we just wanted the best for her. So our nurse was able to help us with developmental, just to help us to make sure that she was developing properly and I was eating healthy for her. So setting goals for her.
Great. And so how often did the nurse come into your home?
It was once every 2 weeks.
Okay.
Approximately, yeah.
So you could kind of save up any questions that were brewing in your mind and talk about when the nurse came by.
Yes. And we had many. We had a lot of questions, really, because what I found from our nurse is that, yeah, your doctor, you go into your doctor, you get checked and that, but we just had many concerns of, am I eating healthy? What is the safe environment for her? What do I need to put up so she's not getting into stuff? And just basically just to make sure our house was safe for her, which was a good thing because we didn't have carbon monoxide detectors or fire ones. So with our nurse, she was go through and make sure our house was safe for her and tell us what we needed to do to make it safe for her when she arrived. So they help with many things.
Excellent.
Other than developmental.
Uh-huh. All right, great. Yeah, and Lynn, as you mentioned, it really is tailored towards the needs and the interests and the goals of the family themselves. So, Lynn, can you talk to us about the primary goals of the program?
So we have 3 primary goals. One is to improve pregnancy outcomes, to have a healthy mom and to have a healthy baby. And the way we do that is to talk with the mom about diet, about drinking plenty of water. We're at altitude up here, and so we talk about drinking 8 ounces 6 times a day, or huge amounts of water. Exercise. Moms who exercise tend to have easier deliveries. We make sure that they're having prenatal care with their doctor. That's very important.
Okay. How about any other goals of?
Our other goals are to focus on child health and development. So I don't know if you know, but babies begin to hear while they're in their tummy, in mommy's tummy, and they can hear very well at 25 weeks. We talk about language development even before they're born.
Oh, wow.
Language development after they're born, reading to children. I'm reading to their children every single day, and then they're more ready for kindergarten. And this program has covered 35 years of evidence showing that these kids actually continue to do better all the way through high school.
Excellent. And so what are some of the typical positive outcomes that you see for folks who are participating in nurse-family partnership?
Connected families, dads tend to be more present, pregnancies tend to be farther spread out so that the mom has more time to spend with her first baby, and more school readiness. They're more ready for school at kindergarten.
Okay. So Nadine, you mentioned before we started that you had one particular health outcome in your family that was really significant that your nurse home visitor was able to help out with. Can you talk about that?
Yes, my husband was involved in the program as well as myself and my daughter.
Mm-hmm.
And he decided he was gonna quit smoking to make a better environment for her. So that was a good thing that came from our nurse, because we just wanted to make sure that she was developing, and we wanted to make a better environment for her. So he did quit smoking because of the nurse family partnership program. So we're very appreciative of that.
Great.
Because that was a good outcome for us.
Yeah, for all 3.
Yes.
All right. So Lynn, can you tell us if people want to get in touch with you to see if they're eligible for the program, or they know someone who might be, or they just want to learn about it, how would they do that?
So we would really like to talk to any first-time pregnant mom in the county.
Okay.
And surrounding counties, the counties I've already mentioned, Chaffee, Lake, Grand Park, Clear Creek, and Gilpin. And they would contact public health. They would be able to direct you to Nurse Family Partnership, or for my own phone number, which we can give 970-668-9711. Happy to talk to every single first-time pregnant mom in the county.
All right, fantastic. Well, thanks so much for your great work, Lynn, and thanks, Nadine, for coming in today and sharing your experiences with us.
Thank you for inviting.
Thank you. All right, we are going to take a quick break, and when we come back, we are going to focus on National Telecommunications Week.